Hey everyone, Bridget here at the AAFE Training Center. We are just going to be doing some talks on my patient this morning. So as you can see, we are treating a lip flip. So we are treating that orbicularis oris muscle, and we're going in very superficially. When you treat this muscle superficially, it causes the deep to recruit and then push that lip outward so that you get a little bit more vertical show. The reason we kind of treat the top and the bottom is just because it's one sphincter muscle. So if you kind of paralyze half of it, then it's going to feel pretty weird for the patient. So we always treat both top and bottom lip, even though they won't get any visible results with the bottom. We are now moving up to my frontalis, so I made sure to mark my lateral borders, and I'm going at about a 25-30 degree angle, and I'm going to give the amount of units that I decided for this patient. Depending on the size of her forehead, the set of her eyes. This patient likes to be pretty frozen, so we go pretty aggressive on the dosing as well. But biggest thing is just making sure to stay above that 1/3 lower of the frontalis. So the lower down you get, the more risk you have of dropping someone's brow. So I always like to stay at least a finger breadth above the top of the brow. Next to my glabella, I'm going straight in 90 degrees into my procerus, and then I'm going to pick up and isolate each corrugator. The reason that I do this is it prevents leakage into the eyelid and then also prevents leakage up into the frontalis. That frontalis runs right underneath of those corrugators, and so if you go a little too deep or if you go not in the correct area, if you're too high or you're too low, you could be hitting a different muscle, which will give them a negative outcome. So always making sure to picking up and isolating those muscles. Next, we are going to go on to this patient's brow lift. So that's still treating the orbicularis oculi muscles that we treat for crow's feet. However, we're just treating pretty far up. So I'm actually treating almost inside of the brow. And what that does is it helps relax the upper part of the orbicularis oculi, which will help to lift the brow and counteract kind of any of that heaviness if she feels that. This patient usually doesn't feel heavy because she has really nice deep set eyes, but it just helps her feel more open and more awake. So then for my crow's feet, I'm going to make sure to stay always up and away from the eye, and then I'm always superficial because once you get into those lower crow's feet, you have a risk of hitting your zygomatic major, which can affect the patient's smile if you're injecting a little too low. So you want to make sure you're tucked into that eye, but you're still outside the side of that orbital rim, just because if you're inside of the orbital rim, it can cause problems like dry eye and make them feel cross-eyed. So just making sure to stay in the correct plane, and then to wipe everything, I just wipe everything up and away. The lip flip, I just try to wipe right where my dots are, just because I don't want it to spread into the rosorius or another smile muscle. I will see this patient back in about 2 weeks to see her results. But thank you guys so much for watching.